Alrighty, hello, welcome to the Town Meeting Talk Show. Haven't had to do one of these for a while, but there's some stuff going on at the state level that we want to make sure that you're aware of, so it seemed like a good idea here for this Friday, August the, whatever it is, 7th? I don't know anymore. It's also the same. This show is brought to you by Cordova Wireless Communications. They are your local cell phone and wireless data provider and the provider of your local talk show, which is on demand. When there's enough stuff to talk about, we talk about it. And when there's not, we don't. You, by the way, are welcome to make recommendations for a guest to have or a topic to be discussed. We're even agreeable to considering reading, kind of like you do with a letter to the editor, that kind of thing. If you want to ship it over and we can make that work, then we're always happy to give things a look. So not a lot of this content here today has to do so much with local response, which we've been covering in the daily briefings. If you want to review any of those, they're all at youtube.com/CordovaTV. I think we visited with Dr. Sanders earlier in the week, Mayor Copeland once. Yesterday we visited with the city manager. And for the most part, the local response is as it has been. We've been seeing some spread. The virus is definitely here. There are active cases, and the point that they've continued to make is that while there are certainly limits on providing details of who has it and how they got it and that sort of thing, they will certainly put out any information if they identify a hot spot that people need to avoid. But barring that, because of privacy rules, this HIPAA you keep hearing about, I should look up what that stands for. I keep forgetting to, but maybe I can pull it up here quick. The Health Insurance Portability and Accountability Act, created in 1996 to protect sensitive patient health information from being disclosed without their knowledge. There you have it. HIPAA, H-I-P-A-A. Not, by the way, H-I-P-P-A, as I see many people spell it on social media. So anyway, that's a law, and it needs to be followed. You have to be particularly careful, of course, in a small community because it's even easier. As we discovered, unfortunately, when we had some of our first cases, people basically, again, using social media, were outing identified cases, which is too bad, because the thing about it, if you haven't heard any of the daily briefings, it, in addition to violating somebody's privacy rights, which you can agree or disagree with whether they should have them or not, but the law says they do have them. But the other problem is that knowing who has the virus doesn't really do anything to protect you from catching it when you're out and about. The analogy I keep using is if you know two people, we'll call them Bill and Ted, and Bill is positive for the virus and gets outed on social media, so everybody knows that Bill has it, and you see Bill, at the store or something, and you go, oh, that's Bill. Well, I got to stay away from Bill. So you give Bill a wide berth, you stay 14 feet away from Bill and end up, walking right by Ted, who's your friend, and you say, hey, Ted, look, there's Bill over there. Bill's sick. And meanwhile, Ted has it too and doesn't know it and isn't symptomatic. And you get within 3 feet of somebody who has no idea they've got it while you're trying to stay 14 feet away from somebody you do know has it, and you can see where that goes. It doesn't help. It's not only unfair, really, for people to be outed the way that has happened sometimes, but it doesn't help you to be any safer. If you really want to be safe, the best strategy to use is to assume that anybody that's not in your household is a potential carrier, because that's a fact. I mean, it's 2 + 2 = 4. It's not subject to interpretation. Anybody out there could have it. So we recommend proceeding accordingly with masks, with distancing, and all the other recommendations. But first, that's sort of a summary of what mainly has been discussed locally. This program actually is designed, as I said, to focus mainly on things that affect us but are rules or policies more or less beyond our borders. And I would say the first, if you haven't heard about this, is that Alaska Airlines is implementing a fairly inflexible mask rule on their flights. The news story that we wrote up that was based on a Facebook post of theirs says, starting today, it's no mask, no travel on Alaska Airlines. The company announced it's launching a new policy that requires all guests age 2 and older to wear a cloth face mask or covering while on board, except when briefly eating or drinking. They say if you're unable to wear a mask throughout the airport and for the duration of your flight for any reason, you won't be able to fly with them. In their announcement, Alaska Airlines said, quote, "For those who don't comply with this policy, our flight attendants are empowered to hand over a yellow card, which will result in the suspension of future travel on Alaska. Thank you for keeping everyone safe," end quote. Admittedly, when I saw that, I thought, how are they going to justify that sort of from an ADA standpoint when you've got somebody that has an actual medical condition like the asthmatics and so forth? I mean, you would think a company of their size would have checked it with the lawyers and made sure, but it seems on the surface like at the corporate level they're kind of asking for it. And by the way, obviously, if you're going to be flying anytime soon, don't take this out on their employees, and wag your finger and rant at desk clerks or especially our local ones, but really anywhere. The employees don't have any choice on this. If you want to yell at somebody about it, that needs to be done up the chain to the people who make these decisions. So let's not be abusive of Alaska Airlines employees. They may not like it any more than anybody else, but this is what they're out with officially. And if you have any questions about it at all, certainly contact them. But it's going to be interesting to see. I don't know if certain respiratory conditions fall under ADA rules or not, but I mean, people that have to be in wheelchairs are not told they can't fly because they need extra assistance or special accommodations or something. So this will be interesting to follow. But that's what it says. So if you have a reason to not wear a mask, or whether it's philosophical or medical or psychological or whatever, you're going to want to reach out to them and find out what's expected. But it seems pretty cut and dry in terms of how they state it here. And that takes effect today. Something else that you may have heard about is that the non-resident travel rules are going to be changing on Tuesday. And they announced this change a while back and then a little more recently announced a change to the change. So we'll go over this here and just give it to you directly from Commissioner Crum, where the news release says, revised state of Alaska travel protocols to prevent the spread of COVID-19 and conserve testing resources will take effect August 11th. The mandate applies to all travelers arriving into Alaska, no matter how they enter the state. Children under 11 will continue to be exempt from the testing requirements. The most significant revision to the mandate is that non-resident travelers may no longer obtain a COVID-19 test for free upon arrival into Alaska at the state's airport testing sites. Non-residents will also no longer have the option for a 5-day pre-test or the option to self-quarantine for 14 days after arriving into the state. Instead, non-residents must now test before traveling to Alaska. They must take a qualifying test 72 hours before they depart and either show proof of a negative result at arrival or quarantine until results are received and submitted. Non-resident travelers who arrive without proof of the 72-hour pretest will be required to pay $250 per test to be tested at an airport testing site. Testing will continue to be provided at no cost at airport testing sites to Alaska residents traveling into the state. Testing at airport sites will also now be opened up for Alaska residents traveling within the state to help prevent the spread of COVID-19 between Alaska's communities. Under the revised mandate, both resident and non-resident travelers will also now be required to fill out a 3-question self-isolation plan in the Alaska Travel Portal, detailing how they plan to isolate if they test positive for COVID-19 while in Alaska. In addition, the mandate clearly explains how all travelers into the state are required to practice strict social distancing for 14 days after arriving into Alaska, or until a second negative result is obtained from a test taken between 7 and 14 days after arriving into the state. Commissioner Crum said, "These revisions are intended to prioritize and conserve our resources to prevent the spread of COVID-19 while still allowing travel to occur. Travel is essential to Alaska's well-being, but by strongly incentivizing testing before travel for non-residents, we expect to reduce the number of travelers who test positive for COVID-19 after arriving into our state. This will allow us to direct resources where they're needed most, and will also allow us to offer testing for intra-state travelers to help protect our rural communities." By the way, if you want to read this news release, it's available at covid19.alaska.gov. So the bullet points here for the 2 different types of travelers. Well, first of all, they have these are things that apply starting August 11th for all travelers, resident and non-resident. Point 1, complete a travel declaration form and self-isolation plan in the Alaska Travel Portal. Point 2, all travelers with negative results must still follow strict social distancing for 14 days after arriving into the state or until the traveler receives a second negative test result from a test taken 7 to 14 days after arrival. And then point 3 for everybody, the 5-day pretest option is no longer available for any travelers. 3 more points now for non-resident travelers specifically. Point 1, test 72 hours before departure and upload the negative result into the Alaska Travel Portal or have results available to show screeners at the airport. If you're still awaiting results by arrival time, travelers will need to upload proof of a test taken into the Alaska Travel Portal or show proof of a test taken to an airport screener and self-quarantine at their own expense while waiting for results. The results must be uploaded into the portal when received. Point 2 for non-residents. If a non-resident arrives without a pretest, testing is available for $250 per test. The traveler will be required to quarantine while waiting on results. And then point 3, the 14-day quarantine option is no longer available for non-resident travelers. Then there are 4 bullet points for resident travelers. Point 1, test 72 hours prior to departure with the same rules as listed for non-residents. Testing at arrival remains available at no cost to Alaska residents. Point 2, the 14-day quarantine option is still available to Alaska residents. So that's the deal, remember, where if you are opposed to testing or you don't like the idea or whatever, you can choose 14-day quarantine in lieu of testing. But it has to be one or the other. Point 3, Alaska residents traveling within the state will now have the option of free testing at the airport sites to prevent bringing the virus into our small communities. And then point 4, proof of Alaska residency can be shown with Alaska driver's license or state-issued ID card, federally recognized Alaska Tribal Identification Card, active duty military ID card or active duty dependent ID card, and or employment verification letter on employer letterhead or school verification letter for in-person schooling stating the traveler is moving to Alaska for employment or school. Now, interestingly, there is also a set of bullet points for critical infrastructure employees. Point 1 there, travel that's deemed essential or for critical infrastructure as previously defined in Health Mandate 10 will continue as it has under existing guidance. Point 2, critical infrastructure workers traveling to Alaska will no longer be able to use state-funded testing at airports. And then point 3, critical infrastructure employees and organizations will be asked to provide employees with a letter on company letterhead that states they are a critical infrastructure worker traveling for work purposes. These letters must include travel plans and confirm that the traveler is following the employer's Community Workforce Protection Plan on file with the state that includes testing and or quarantine provisions. So if you want to, that's the end of the news release there. If you want to look at this stuff in print, you would go to covid19.alaska.gov and search around for Alaska's new travel protocols. That travel portal they've been talking about, by the way, the direct address on the web to that is alaska.covidsecureapp.com. alaska.covidsecureapp with 2 P's.com. Now, there were some interesting points. By the way, you're listening to Town Meeting for Friday, August 7th. Good to have you here. If you're joining us late, this program will be uploaded to youtube.com/Cordova TV, as all of our talk shows are now, thanks to Robbie's creation of that YouTube channel, which I continue to appreciate. This Alaska Weekly Case Update that the state puts out, the Alaska Department of Health and Social Services, had some interesting information on disease vectors, basically, because if you've been following the state count, it's been leaping. We had a string of days of over 100. One day was even close to 200 discoveries of new cases. So it seemed like it was kind of starting to get out of control there. Although, as I followed the state chart, it didn't seem like we were getting to the point that the medical facilities were going to get overwhelmed. There were times when the capacity was somewhat over half, except on the ventilators. Ventilator use has continued to be low, which is good, really. The information I've been tracking sort of indicated that early on, when much less was known about this virus, that there were people being put on ventilators that didn't actually need it. They kind of learned as they went that possibly the ventilators were being used too soon. And they found other less invasive ways to deal with people who are oxygen deprived. But it's been a substantial couple of weeks in the state, and because of the contact tracing that they've been doing, they've been able to pin down a little more now where the case spread is coming from and make some recommendations. So here are the highlights. I'm not going to read the whole thing, but the highlights from the latest weekly case update. This is coming off of this relatively bad period. They say Alaska continues to have rapid increases in resident and non-resident new cases, although I would say as a sidebar that's been rolling down some. Yesterday's report was 42 new cases discovered, which is not awesome, but it's also not 150 to 200. So it certainly seems to be moving in the right direction. But Alaska continues to have increases in cases. They say the biggest increase this week was in Anchorage, which had 505 new cases, or 67% of the overall week's increase. Total cases in Alaska rose 30% last week, with 755 new ones, the most Alaska has had in a single week. Now, this is where it gets kind of interesting. Most new cases in Alaskans are acquired from other Alaskans who have not traveled. And then it goes on to say transmission between Alaskans at social gatherings, within families, at community events, churches, and bars has significantly contributed to the rise in cases. So around the state, it's Alaskans spreading it to other Alaskans. Now, it may have been that the when our cases started to rise, that it was some people that brought it in from outside. I mean, it would almost have to be because, we had a number of days there where there were 0 new cases in the state, or 1 or 2 or 10 or something like that. And then it just sort of exploded when things began to open back up and when the very restrictive travel bans went away. So, I mean, you can blame it on people coming into the state, but the fact is now that we're mostly passing it to each other in Alaska. And the big gatherings seem to be the primary vectors. Again, they pointed out social gatherings within families, community events, churches, and bars. There were more than 4 times as many people hospitalized in July as there were in June or previous months. Cases are expected to continue to rise, although several communities have adopted more restrictions. The majority of new cases continue to be among younger adults, particularly Alaskans in their 20s and 30s. Most non-resident cases have been identified before the person had significant community interaction. Kind of like, has happened with Ocean Beauty, for example. That's where we had some of the initial seafood cases. You'll remember way back when we had our first one. So they isolated that person, and because they caught it and didn't have any spread beyond that. So apparently the system is working real well, isolating the non-residents that are bringing it in now. What's not working as well is Alaskans getting complacent. And this has been the concern in Cordova, too. Both the manager, actually all of them, everybody we talked to this week, has said that community transmission is here and it's occurring, and we have virtually all the power to stop spreading it among ourselves by following the recommendations. And those recommendations, as stated in this same document I've been sharing with you here, it says Alaskans should avoid gatherings, wear masks in public, keep 6 feet of distance from non-household members, and practice good hand hygiene to slow transmission of COVID-19. It was regarding the masks, and I know masks continue to be controversial, and we don't take a position of wagging our fingers and telling you to do one thing or the other. It was interesting, though. I was reading a report out of the Interior where their incident command up in the Fairbanks North Star Borough, their incident command team had a meeting, and they were talking a lot about masks and noted an interesting statistic that since most of the major medical facilities up there are run by a group called Foundation Health Partners, and when they implemented, they've got about 1,850 employees, and after they implemented their mandatory mask rule, they have had 0 cases out of those 1,850 employees, 0 cases of an employee passing it to an employee or an employee passing it to a resident. Now, again, I don't share that with any sort of judgment. It's basically an anecdotal example, but it is a fact, and we like to share facts, and you decide what to do with them. Another section in this weekly case update was some interesting illumination on how the virus is moving around. They have a section that says how Alaskans acquired COVID-19. DHSS monitors how people most likely got the virus. It says in March, a substantial portion of Alaskan cases were related to Alaskans returning from elsewhere, while in April and May, fewer Alaskans traveled. Since June, as travel started to increase, cases in Alaskans related to travel began to occur more regularly. They go on to mention that people should expect there are cases in communities that have not been found. And again, the biggest increase in Alaska is people aged 20 to 39, with many cases linked to bars and social gatherings. So there again, those two seem to be the 2 primary vectors. And then they emphasize Alaskans can help contact tracers move faster and prevent more cases by keeping their contact list small, keeping a diary of who they're in close contact with, which they define as within 6 feet for 10 minutes or more. I remember when Kathy Sherman said that was a good idea before it was considered a good idea statewide. So go Kathy Sherman. So keep bubbles small, keep diaries of who you interact with, wear masks when around any non-household members, wear masks around any non-household members or when you're in public, and if the contact tracers reach out to you, please respond promptly. So that reinforces my mindset. It's always fun when something reinforces your mindset of just, assume anybody not in your household could be carrying it when you're out. And if you do, you substantially increase your chances of not getting it. They mention that hospitals have remained below capacity with ventilators and ICU beds available, although use has been rising. Even after the tough week here, inpatient bed capacity is at about 1,400 and use is around 879, so that's about 60%-ish, give or take. ICU bed capacity in the state is 163, and 87 are in use. Ventilator capacity is 286, and only 33 of those are in use. As far as the fatalities, 24 Alaskans are reported as having died from COVID-19, although several of these deaths occurred in Alaskans who acquired the disease in another state and never traveled to Alaska during their illness. They're counted as deaths in Alaska's reporting by national convention. And in pretty much I don't see the statistic in here on pre-existing conditions, but I'm pretty sure that every fatality so far was pretty advanced in age or there was an underlying condition, whether it was respiratory or diabetic or something like that. I don't know that Alaska has had one of these freaky cases where a normal, healthy 30-year-old became a fatality. And that's always been the concern, which actually leads to the final point, or final news release I wanted to share, which is unfortunate. The last thing that you want to see happen, which is cases of COVID-19 being identified at the Anchorage Pioneer Home. I don't know if anybody here has relatives that are up there or knows people who have relatives are up there. But, this, of course, is really the worst case scenario in terms of a facility where you don't want to see the virus starting to spread around. So this report says the Alaska Department of Health and Social Services has confirmed 4 positive COVID-19 cases at the Anchorage Pioneer Home, including 3 residents and 1 staff member. Upon being notified about the first case of a resident, Alaska Pioneer Home leadership immediately began working with the DHSS Division of Public Health Section of Epidemiology to respond to the case, identify any other cases, and take additional steps to prevent further spread. After the initial resident case was identified, 3 additional cases were found during testing of residents and staff. The 3 residents live in the same neighborhood within the home, which is separated from other neighborhoods, and they are all now in isolation. All 4 cases are still under investigation. These are the first positive COVID-19 cases in elders at any of the Alaska Pioneer Homes, and this is only the second occurrence of COVID-19 associated with the Alaska Pioneer Homes. In June, an employee at the Fairbanks Pioneer Home tested positive for the virus, but that didn't get to the residents. And so then they go on to talk about actions that are being taken with isolating people and thorough sanitizing and adjusting services and so forth. So hopefully that will remain contained, but you sure hate to see 3 of those vulnerable residents. I mean, you may remember from the early news report, that's a significant part of why New York's numbers were so bad in the early going, were because the virus just rocketed through a number of their assisted living facilities, and that's your most vulnerable population there. So hopefully we won't see something like that happen in our largest city. But as we wrap up here, turning things back to largely the positive for us in Cordova. While we do have some virus here, we seem to be doing pretty well not letting rises in case counts turn into anything that could be classified as an outbreak. You know, we had that period where we went up to about 4 active cases and then went completely back down to 0. Now we hit this point where we've got, I forget if it's 5 or 6. I don't have the chart in front of me. Actually, let me grab it here. We'll take a look. Yeah, it's still the same, at least as of this morning, and it'll update, I think, around noon. But 5 active resident cases and 1 active non-resident case. So, more than we've had, but not considered out of control by our experts, by the IMT and by Dr. Sanders, who we spoke to about that recent increase, I think, on Monday's briefing. And I'll be communicating with the mayor and manager and Dr. Sanders to, as we plan for today's briefing and kind of see if there's any change in their posture. But basically, it's been consistent messaging. It really is within our power as individuals and as community members to keep it contained. You know, we've heard from the state that the primary concerns are the larger social gatherings. That's the way most people are getting it. So if you avoid those, you should be in pretty good shape. If you avoid close contact with pretty much anybody outside your household, you should be in pretty good shape. If you're particularly concerned, again, use, even if it's okay, even if it's allowed to go into stores, you don't have to. The stores, as far as I know, have continued to be more than happy to do curbside delivery. I don't know if some of them are still actually delivering or not. I haven't heard any updates on that, but I mean, these are our local businesses, and good local businesses are willing to work with you so you can have a business relationship with them in these weird times. So we have the ability to keep ourselves and our families and each other safe by following this guidance. I mean, I remember the last time we had Dr. Zink on one of our shows, she said, you know, if everybody basically stopped moving, if that was possible, and obviously there are reasons that that's somewhat impractical, but I mean, just in theory, hypothetically, if we all went home and just stayed there for 2 weeks across the planet, the pandemic would largely be over. It's considered to have a 2-week survival rate. If nobody went anywhere for 2 weeks, it would just die out, in theory. But there are a lot of reasons why that's not necessarily practical, and so these preventative measures fill in the gap. And so we hope you'll be able to take all of this and go boldly forth into the weekend. We'll have our daily briefings later at 1 p.m., 5 p.m., and 8 p.m. This has been the Town Meeting Talk Show, always seeking to inform you, thanks to Cordova Wireless Communications. Not only keeping the money you spend with them in town, but also bringing oodles of new cash into town because of their magical way of being able to do that, which I haven't talked to them about it in a while. It's grants and subsidies and things like that pour into the town, you know, to the tunes of millions of dollars every single year. So that's pretty nice to have when the economy is not exactly in fifth gear. As always, it's a pleasure serving you here on local radio. We will get all of the programming to which you are entitled during the 10 a.m. hour lined up and not missed. We'll see you for the briefings a little later. And we hope you have a great, safe weekend, 6 feet apart.